Hi guys, so I'm very comfortable in bed today. Make sure you're nice and comfortable too. Get some snacks and a cup of tea if you would like one, and we'll get into it. So I wanted to do a video like this because when you Google EDS, you're often doing so because you want to see what this thing is and how it affects people. But I have found that it just doesn't do justice what we go through. Like if you look it up on the NHS website, which is our National Health Service here in the UK, the first symptoms that come up are an increased range of joint movement, stretchy skin, and fragile skin that breaks or bruises easily. And while it's true that those are symptoms that a lot of people with EDS have, for most of us, it doesn't describe our experience of EDS very well. Like if I was going to talk about my experience with EDS, I would not talk about the stretchy skin, I would not talk about the fragile skin, and actually I wouldn't talk about the increased range of joint movement either. And so I wanted to do this video because I want people to have a place to go to see what they can expect from EDS, and also for people's friends and family. So you might have a family member that doesn't understand your condition, but they've tried to understand, they've Googled it, and then they've read stretchy skin and so they still don't get it. So the purpose of this video is to go a bit deeper into the individual experience of EDS. How does it typically affect people? Because actually, after my time in the community talking to thousands of people with EDS of all types, because remember there are 13 types, it's not just one condition, I have found that there are quite a lot of similarities between people with EDS, and the significant things we seem to share and have in common actually go a lot further than just stretchy skin and that sort of thing. So just to start with the sciencey stuff so that we understand what we're talking about, EDS is a group of inherited connective tissue disorders. This means there's more than one condition, but they do tend to be quite similar, and they're connective tissue disorders. So a connective tissue is something that provides support in your skin, tendons, ligaments, blood vessels, internal organs and bones. So as you can see, that's a lot of things, and that is why it does produce such a wide range of symptoms, and it can just mess with your whole body because it affects nearly every body system, if not every body system. So that's what it is, and these conditions really vary from one person to another. Someone could be mildly affected, whereas someone else could be severely affected. Vascular EDS, for example, is the most serious type because it has a lot of life-threatening complications. You'll see that it says this everywhere online, but actually some of the other types can have pretty serious implications as well. So we're going to be talking about that in this video. So now we know a bit about what EDS is, we're going to talk about how EDS typically affects a person. So the first one I wanted to talk about is joint problems. Joint problems are very common with EDS. They can cause a lot of pain and they can also cause instability. So with the tendons and ligaments being a bit more stretchy and lax, this can make people with EDS prone to dislocating or partially dislocating their joints. Not everyone experiences it, so you don't have to have dislocations to have EDS, but a lot of people with EDS do experience joint pain. Because of this, a person could need painkillers, physiotherapy, braces and supports. I'm wearing a knee brace right now, but I'm also wearing a dress, so I don't know how well I'm going to be able to show you. You can sort of see the knee brace there. I also have thumb braces as well for my CMC joint, and that's very common with EDS, but at the same time it's not everyone, so it all depends on the individual person. Some people could also require surgeries or an aid to help them, such as a wheelchair or a walking stick. The next way that EDS affects a lot of people is that it can cause a comorbid condition called POTS. Comorbid means secondary, so in this case EDS could cause a condition called POTS, which stands for Postural Orthostatic Tachycardia Syndrome. This means that you get a fast heart rate in response to a postural change. So if you go from lying to sitting, or if you go from sitting to standing. This is because in people with EDS, the blood vessels can be very stretchy, and so they don't always circulate the blood around the body as efficiently as in a healthy person. To compensate this, the heart beats faster to try and get that blood moving, but it is beating harder and faster but less efficiently, and it's battling to keep the blood moving up to your brain, and especially to get oxygenated blood to your brain. And so this can cause a whole host of symptoms, the main ones being lightheadedness and dizziness because you're not getting as much oxygen in the brain, palpitations and chest pain because your heart is beating hard and fast. Fainting is another common one, but everyone would have a different threshold for this, so it doesn't necessarily mean that your POTS is better or worse if you do or don't faint, and you definitely don't have to faint to have EDS. It all depends on what your body can cope with, and I'll put the full list of symptoms on the screen. So as you can see, this one really can be quite debilitating. Again, not everyone with EDS has it, so it's possible to have EDS and to not have this, but if you do have POTS, then you would experience some of these things. So what can you expect from a person with POTS, and what is there to help it? Well, some of the main treatment includes medications to lower the heart rate. I have a video which you can check out here. This has a lot of advice about what you can do to help your POTS and how to make it better. I go into more detail about the medications, but the medications can really help. My heart rate is actually really high right now, and I'm going to have to take a break. So I will just sit still for a couple of seconds and let my heart rate come down, and then I'll be back. So other things that can help with POTS include compression wear. This can be things like compression leggings and compression socks. These constrict your legs, and I guess a little bit constrict the blood vessels, and so they help with the blood circulation and they stop the blood from pooling in your legs. Someone who has POTS might also use a wheelchair because it stops them having to stand up and endure that postural change, which causes the tachycardia and all of the symptoms. But again, it depends on the person. Some people with POTS may find a walking stick helpful to help them balance when they're feeling dizzy. Some people may use a rollator with a seat so that they can stop and take rest breaks. And then, like me, some people might use a wheelchair because they're unable to stand up for very long. Another thing that's very common in people with EDS is bladder and bowel problems. So we'll start with bladder problems, and the most common sort of symptoms tend to be things like urinary retention, which is where a person is unable to empty their bladder either at all or partially. So this can require a person to use catheters. I know a lot of people with EDS who have to use catheters. I'm in a group, for example, where it's me and about 10 friends, and I'd say about half of us use catheters, so it's a very common thing for people with EDS. And then on the other side of the spectrum, you could be dealing with things like urgency and frequency, where you're needing to go to the toilet a lot. You could also have pain and UTI type symptoms. So real joyous condition, EDS. I would say if your only symptoms are urinary frequency and urgency, my main thought wouldn't be EDS. Like, it's not something that I would think of straight away, as there are so many things that can cause that. But with urinary retention, it would be a red flag where I would be wondering, could EDS be behind it? Again, of course, there are so many causes for this, and it could be other things. But if a person were to have urinary retention and joint pain and POTS, I would be thinking this person could very well have EDS. And then with the bowel conditions, so a very common one again is constipation and GI dysmotility, and specifically intestinal dysmotility. This is where the intestines and bowels move very slowly, and so it's difficult to go to the toilet. A lot of people with EDS have to use laxatives, which is a medication that helps you go to the bathroom. They could use enemas, look that one up. And also suppositories, which is a medication which goes in the other end to help a person go to the toilet. And then less commonly, but still affecting a large amount of people, there are cases where a person may have to use an irrigation system, which is where they, I don't know what the word would be, we'll say infuse, but that might not be the right word. They have to put up a large volume, we'll get onto this symptom in a minute. They have to put a large volume of water or some sort of liquid into their bowels to help get things moving. And some people even need stoma surgery, where they get an ileostomy or a colostomy to help them empty their bowels. And same with the bladder stuff, this can go the other way as well. And people with EDS can also deal with things like constipation, abdominal pain, cramps, and all of that sort of thing. Now, the dysmotility and constipation is very common and associated with hypermobility. I would imagine it's due to the stretchiness of the tissues again, so maybe the bowels are too stretchy to get things moving, and it affects the nerves and the muscles and everything. So same with the bladder stuff. I would say if you're more on the diarrhea side of the spectrum and that's your only symptom, I wouldn't be thinking of EDS at that stage. But then if you had any of these symptoms in combination with the other things, so the POTS and the joint problems, I would be thinking, could EDS be a possible cause? The next thing that's common in people with EDS is a condition called gastroparesis. This literally translates to paralysis of the stomach. So this is where the stomach empties too slowly, and in severe cases it could barely empty at all. So your stomach is going to empty down into your intestines and pass food through your body that way to be broken down and metabolized. In someone with gastroparesis, it moves so slowly that it causes a host of symptoms, commonly things like nausea and vomiting, feeling full very quickly from eating. You might eat a small amount and find yourself full up, bloating, weight loss, loss of appetite. All of this is very common in a person with EDS. I probably should have said earlier, but with the gastroparesis and the POTS, you can't diagnose a person just from their symptoms. A diagnosis is based on tests that have quantifiable results. So in POTS, it's to do with your heart rate, and they test your heart rate when you go from lying to standing. I have a video if you'd like to test yourself for POTS at home. And then with gastroparesis, the test is usually where you eat a radioactive substance, and they take scans over several hours to see how quickly it's moving through your body. If it's moving too slowly, that would be indicative of gastroparesis, and that would allow them to give you a gastroparesis diagnosis. There are a couple of other methods as well, such as a little camera that you can swallow and see how quickly it goes through your body, and a few other methods as well. But anyway, back to how this affects a person. This one can be really quite debilitating. Anyone who suffers from chronic nausea or chronic vomiting knows that nausea and vomiting can completely wipe you out and make you feel dreadful. But even more than that, if it reaches the stage of malnutrition, it can become very dangerous and potentially even life-threatening. So someone with gastroparesis may need to use a feeding tube, where they're fed into a tube that could go into their stomach. I was pointing up here because sometimes you can have a nasal tube, so it goes into your nose, and then it either goes into your stomach or into a part of your intestines. If they don't tolerate that, they can also be fed through a central line, which is where they're delivered nutrition essentially through the heart, and sort of bypassing the whole GI tract if it's just not functioning well enough. There are a couple of medications that can help. Some of them are anti-sickness medications, so that does help a lot of people. And then for other people, they may need a medication that speeds up the stomach and the gastric emptying. I think it's called domperidone, that's one of them, and potentially erythromycin. I'm going to have to check that, but I think those are the two I know of that speed up stomach emptying. I also want to mention as well that even though it's common for people to be underweight with gastroparesis or to have feeding tubes and things like that, you could also have someone that has weight gain from it and deals with a lot of bloating. And so it's important to know that there is no look to gastroparesis. It's not just a thin person with a feeding tube. It could be someone who's a bit larger that doesn't have a feeding tube, and that's not to say that they don't struggle with it just as much. So yeah, that one can be common as well. And then the last way that EDS often affects people is by causing a condition called MCAS, or mast cell activation syndrome. So I've very recently had mast cell problems diagnosed, and I don't know a whole lot about it. To start with, it put me off doing the video because I didn't want to get anything wrong, but actually I would hope that people watching this video can appreciate that I'm just a girl on the internet. I'm not a doctor, and I'm not a specialist by any means, but I do have some understanding, and I thought I would share what I know, and also my experience of talking to a lot of people with this condition. So mast cells are a part of your body's immune response, so they deal with immunity, and also things like allergies comes into play here. So MCAS can cause you to have a lot of different allergies, and these allergies can also come and go. You might find yourself allergic to something on one day and not another day. It's a very, I don't know if you'd say like temperamental disorder. So that of course can make things really tricky for someone suffering with MCAS, because they could suddenly find themselves with a new trigger and not know what's causing it. And in a person with mast cell activation syndrome, they have the normal amount of mast cells, but they're not functioning in a productive and typical way, and that's what causes the issues. This can cause things that are really extreme, such as anaphylaxis. As far as I understand it, the anaphylaxis is slightly different to a typical allergy, but no less severe. It's still a very serious condition when you have anaphylaxis of any form. I know a couple of people that have suffered terribly from this, so I've seen how severe it can be. And then on the flip side, you could have someone like me where my mast cell problems are pretty mild. I suffer from a lot of skin rashes, I suffer from headaches, nausea and vomiting, just to name a few. But these things for me are uncomfortable. When I'm vomiting, it feels worse than uncomfortable. But all I mean by that is that for me...
touch wood. I don't know if that is wood. Not this. I was touching something next to it.
Yeah, luckily this condition isn't severe for everyone. But with all of this stuff, it's such a spectrum. So for example, I would describe my POTS as being extremely severe. I have I have gone through a lot with that, but then my mast cell problems wouldn't fall into the severe category. So a person with EDS could find that they have some symptoms that are really severe and others that are less severe, and it just depends on the person how they're affected. Just need to reposition because of pain. I would normally edit this stuff out, but since we're talking about EDS, anything goes. So lastly, we'll talk about what things can help a person with MCAS, or just what you might notice about them. So as I said, with the anaphylaxis, some people may have to carry EpiPens, they may have to use face masks to stop themselves coming into contact with their triggers as much. They may have to eat a restricted diet, and they may have to be on medication to stabilise their mast cells, or an antihistamine to help them with their allergies. I didn't write any notes of this, so I'm just trying to think of things off the top of my head from what I experience and what a lot of the people I've spoke to experience, and just what I've seen. So I hope you'll find this helpful, even though it's just like a patient's perspective rather than being some scientific account. And then in line with the restrictive diet, some people may have to be careful about what cleaning products they use, what products they use to wash their hair and to shower, and just anything. They could be allergic to anything. So it may be helpful to think about it as an allergy condition. And I think it probably does fall into an allergy sort of category. Brain fog is starting to catch up with me, which is where your thoughts get a bit muddled and it gets a bit harder to think. That's another symptom of POTS. So I'm going to wrap this one up and leave it here. So I hope you found this helpful. Give it a thumbs up if you did, and I'll see you in the next video. Bye.